Howdy, howdy. So I'll just get right into this. All right, are you ready for me to take a peek at your belly and we can measure this baby and see what's going on? I'm assuming for the video we're probably somewhere between 36 and 38 weeks, since my Squishmallow in my pillow is kind of approximately that size. So, all right, thank you so much. So, we'll first just check and see where the top of your uterus is. My pillow's kind of running out of space, but trying to identify the fundus. All right, sounds good. And now let's see if we can find the back. And I'm paying attention to note if there's any tenderness, any skin abnormalities like rashes, abrasions, eczema. Noting stretch marks, quality, and health of the skin, and kind of getting an assessment for the uterine tone. I've been seeing a lot of second and third time patients, so we'll just kind of assume that we've got a slightly more generous belly. All right, so I'm gonna go ahead and say that the back is on the left, just because kind of what I often find. It feels like the back's over here. Right, now we'll come down here. We'll have you pull your pants just a smidge, pretty low, and I'll see if I can identify what we've got going on in here. This can be pretty uncomfortable for some people, so I always try to be as gentle as I can be. Sometimes it isn't always super obvious, but we're trying to assess, is this the head? Can we feel shoulders? Do we feel pretty round and firm? Kind of going ahead and comparing to what we feel up here. Over here seems a little bit less firm, a little bit more square. I think we feel some small parts over here on this right side. I'm pretty sure we're feeling legs kicking over here. This feels like it's the head. I'm pretty satisfied with that. We're gonna come down. I am really not super good at this, but come along this side, see if we can identify the attitude, see if we're flexed well or not as well. Okay, so all right, let's go ahead and measure. Come down here and find your pubic bone. All right, I think that feels like that. Okay, let's see. Come right to the most superior part of the bone that I can find. Coming up here. Being sure to come straight down over the highest part that I can find. And obviously this is a fictional belly, but we're measuring 43 inches. We're just gonna say that that's pretty comparable to our gestational age. All right, and then I don't have a fetoscope or a Doppler on me, but we'll just pretend that this is a fetoscope, and let's take a peek and see if we can listen. Based on where we're finding the back, I think we're gonna be over here in the left lower quadrant. And then usually I do use a Doppler. Sometimes we will whip out a fetoscope if we're feeling like we're a little bit more unsure of fetal position. But so usually with the Doppler, it shuts off at 3 minutes. So we usually kind of listen for 3 minutes and see if we can get a good sense of the baseline and note any accelerations. We would note any fetal movement that we're coming across that's been prompted by all the palpation. And we'll just say, for the sake of the video, it's been 3 minutes. And we'll just say baseline's 135. We'll put that all in the chart. And I think that's pretty good.